The kidneys are two bean-shaped organs located in the lower back, playing a crucial role in maintaining our overall health. They filter waste products, excess water, and other impurities from the blood, regulating electrolyte levels and maintaining acid-base balance. The kidneys receive approximately 20% of the heart's output, filtering around 200 liters of blood daily. This process is essential for removing waste products, such as urea, creatinine, and other toxins, which are then excreted in the urine. The kidneys also regulate blood pressure, produce hormones like erythropoietin and calcitriol, and maintain electrolyte balance. In this section, we'll explore the importance of kidney function and the consequences of kidney disease. Kidney disease can lead to a range of complications, including cardiovascular disease, anemia, and bone disease. It's essential to understand how the kidneys work and the factors that can affect their function, such as diabetes, high blood pressure, and family history. By understanding kidney function, we can take steps to protect these vital organs and maintain our overall health. The kidneys consist of several layers, including the renal cortex, renal medulla, and renal pelvis. The renal cortex is the outermost layer, containing the renal corpuscles, which are the functional units of the kidney. Each renal corpuscle consists of a glomerulus, a tuft of blood capillaries, surrounded by a Bowman's capsule. The renal medulla is the inner layer, containing the renal pyramids, which are made up of collecting ducts and loops of Henle. The renal pelvis is a funnel-shaped structure that collects urine from the calyces and channels it into the ureter. The kidneys are also surrounded by a layer of fatty tissue, known as the renal fascia, which helps to cushion and support the organs. The renal arteries supply blood to the kidneys, while the renal veins return filtered blood to the heart. In this section, we'll examine the anatomy of the kidneys in more detail, exploring the structures responsible for filtration, reabsorption, and secretion. We'll also discuss the blood supply to the kidneys and the role of the renal nerves in regulating kidney function. The renal corpuscle is the functional unit of the kidney, responsible for filtering the blood. It consists of a glomerulus, a tuft of blood capillaries, surrounded by a Bowman's capsule. The glomerulus is a network of blood vessels that allows for the exchange of substances between the blood and the filtrate. The filtrate then passes into the Bowman's capsule, which surrounds the glomerulus. The renal corpuscle is responsible for filtering around 120 milliliters of blood per minute, removing waste products and excess substances. The glomerulus is also responsible for regulating blood pressure through the renin-angiotensin-aldosterone system. In this section, we'll explore the structure and function of the renal corpuscle and glomerulus, examining the mechanisms that regulate filtration and blood pressure. We'll also discuss the importance of the glomerulus in maintaining kidney function and the consequences of glomerular disease. The nephron is the functional unit of the kidney, responsible for filtering the blood and regulating electrolyte levels. It consists of the renal corpuscle, proximal convoluted tubule, loop of Henle, and distal convoluted tubule. The proximal convoluted tubule is responsible for reabsorbing glucose, amino acids, and other essential nutrients. The loop of Henle is responsible for concentrating or diluting the urine, depending on the body's needs. The distal convoluted tubule is responsible for regulating electrolyte levels, including sodium, potassium, and calcium. In this section, we'll explore the structure and function of the nephron, examining the mechanisms that regulate tubular reabsorption and secretion. We'll also discuss the importance of the nephron in maintaining electrolyte balance and the consequences of nephron disease. The kidneys filter waste products and excess substances from the blood through a process of filtration. reabsorption, and secretion. Filtration occurs in the glomerulus, where water, ions, and small molecules are removed from the blood. Reabsorption occurs in the renal tubules, where essential nutrients and electrolytes are reabsorbed back into the blood. Secretion occurs in the renal tubules, where waste products and excess substances are secreted into the urine. In this section, we'll explore the mechanisms that regulate filtration, reabsorption, and secretion, examining the role of the glomerulus, renal tubules, and collecting ducts. We'll also discuss the importance of these processes in maintaining kidney function and the consequences of dysfunction. The kidneys play a critical role in regulating electrolyte levels, including sodium, potassium, and calcium. The kidneys regulate electrolyte levels through a combination of filtration, reabsorption, and the kidneys play a critical role in maintaining acid-base balance, regulating the levels of hydrogen and bicarbonate ions in the blood. The kidneys regulate acid-base balance through a combination of filtration, reabsorption, and secretion. The renal tubules are responsible for reabsorbing or secreting hydrogen and bicarbonate ions, depending on the body's needs. The kidneys also regulate acid-base balance through the production of ammonia, which helps to buffer excess hydrogen ions. In this section, we'll explore the mechanisms that regulate acid-base balance, examining the role of the kidneys, lungs, and liver. We'll also discuss the importance of acid-base balance in maintaining overall health and the consequences of acid-base imbalance. In conclusion, the kidneys play a vital role in maintaining our overall health, filtering waste products and excess substances from the blood, regulating electrolyte levels, and maintaining acid-base balance. The kidneys consist of several layers, including the renal cortex, renal medulla, and renal pelvis, and are surrounded by a layer of fatty tissue. The renal corpuscle and glomerulus are responsible for filtering the blood, while the nephron and tubular reabsorption regulate electrolyte levels. The kidneys also regulate electrolyte balance and acid-base balance through a combination of filtration, reabsorption, and secretion. In this video, we've explored the anatomy and physiology of kidney function, examining the complex processes that enable these vital organs to maintain our overall health. By understanding how the kidneys work, we can take steps to protect these vital organs and maintain our overall health. It's essential to remember that kidney disease can have serious consequences, including cardiovascular disease, anemia, and bone disease. By taking care of our kidneys, we can prevent these complications and maintain our overall health.